Hey, I'm Brooks with BrooksBrownCoaching.com, and in this video, I'm going to discuss how the amount and types of dietary fat you eat could affect your hormones. So I've done a video already about how your body fat can affect your hormones. If you're interested in that, you can check that out here. But in this video, I'm going to talk about the fat that you're actually eating. So what seem to be the right amounts of fat as a percent of your total calories, and then what types of fat should you eat if you want to increase your testosterone levels based on the research. There's a lot of people out there saying, this type of diet or that type of diet, and this is how much fat you should eat. Anywhere from almost none all the way up to 70% of your calories from fat. So I'm just going to talk about what the data seems to show, and then you can kind of make the decisions on your own. First, I want to start off by discussing what the different types of fat are. So we have fat broadly that you'll see on a nutrition label. You'll see fat. Under that, you'll see typically saturated fat. And then under that, you'll probably see unsaturated fat. And that can be broken down into monounsaturated fat, polyunsaturated fat, and then additionally trans fat, which you should not be seeing any of on your labels in the United States anymore. I'll discuss why in a bit. But saturated fatty acids are typically going to be solid at room temperature. This is going to be something like butter, beef tallow, the fat on meat, so animal fat. Coconut oil is a source of saturated fat from plants. So it's not just from animals, but think of all those are solid at room temperature unless something's been done to them. You can get liquid coconut oil, but in its normal state, it's going to be a solid at room temperature. Monounsaturated fat, these are the things you're going to get from fatty fish, like salmon, olive oil, avocado, walnuts, pumpkin seeds. And then you have polyunsaturated fats, which are going to be a liquid at room temperature. And those are going to be typically seed oils, lots of different types of cooking oils like soy, corn, safflower, sunflower, canola. Those are all polyunsaturated fats. And trans fats are not generally naturally occurring in nature. They are in a few places, but they're pretty rare. Trans fats, you typically are going to be made from a process called hydrogenation, where a food manufacturer takes a seed oil and unsaturated fat, goes through the process of hydrogenation, which is bonding this unsaturated fat with hydrogen to create a solid or semi-solid fat that can then be used as a cheap source of stabilizing fat in processed foods. So really, that's something you really want to look out for. You'll see that trans fats are not good for your testosterone here in a minute, but they also have a lot of negative side effects, particularly on your cardiovascular system. So we want to avoid those as we can. And you'll see those on labels as hydrogenated or partially hydrogenated oils. So just steer clear of those. So let's go up to some of the studies and see what the data really shows about the amount of fat you're eating, and then what types of fat are best. So I'll start out with a study that came out of Finland. There was a group of guys that were physically trained. They had already been doing resistance exercise. This wasn't like they just started a workout program. And the whole point of the study was to test what your testosterone levels and your cortisol levels did during a workout. So they took the guy's blood, multiple guys, they took their blood right before they worked out, and then they took it afterwards to see what happened with their testosterone levels. All the guys did the same exercises with weights that were altered to fit their strength. So, they got this as even as they could, try to minimize as many variables as possible. And the exercises were a bench press and I think a jump squat for a certain number of reps. The only changes they made throughout the study, and it was only a 17-day study, which is important. You'll see why in a second. The only change they made is they decreased the guy's fat from 40% of their total calories down to 20% of their total calories, back up to 40% of their total calories. And all this happened in a span of 17 days. When they dropped their calories from fat down to 20%, they saw a 15% decrease in average of testosterone levels in their participants. That is very significant. 15% is a significant number when you're talking about your circulating testosterone levels. And then when they pushed their calories back up to 40% of their calories from fat, they got back up to their baseline levels. So that happened in just 17 days. So you could see that quickly a dietary change can make a big difference in your levels of testosterone. Now, there is a bit of a caveat to that. It's not just any type of fat. What they showed is guys that had a higher level of saturated fat to polyunsaturated fat ratio had higher testosterone levels. Meaning, let's say of that set number of calories they were eating, those fat calories, if one guy is eating 80% of his calories from saturated fat and only 20% of his calories from polyunsaturated fat, his testosterone levels are going to be higher than a guy whose saturated fat and polyunsaturated fat is 50-50, right? So the higher that polyunsaturated fat content or that ratio gets in your diet, the lower your testosterone levels are going to go. And it is a pretty significant and precipitous drop, meaning if you keep pushing the polyunsaturated fat up, the testosterone levels are going to keep going down. It doesn't really hit a place and then bottom out. So one of the reasons for that is polyunsaturated fats seem to really increase your production of something called a sex hormone binding globulin. So this is something circulating in your blood that will bind to sex hormones such as testosterone and make them inaccessible to your body. So this can, you might look at your total test and those numbers could be high, but if you have high levels of sex hormone binding globulin, your free testosterone is going to be lower because that SHBG, short for sex hormone binding globulin, is making that testosterone inaccessible. So that's what that polyunsaturated fatty acid did. It drove those SHBG levels up and effectively decreased men's free testosterone that they could use, meaning typically less anabolic effect on improving skeletal muscle, less virility, harder time losing fat. So that higher ratio of saturated fatty acids to polyunsaturated fatty acids was positively correlated with higher testosterone levels. Now, there's been quite a few other studies done on this topic. Some of them not so great. One of the largest ones, they took people that had, they were eating a Mediterranean diet, which was pretty low in saturated fat. I believe a generally low fat diet, which was less than 20% of your calories from fat per day. And then a big cohort of people that had an unlimited diet. So they weren't doing any diet at all. They ate whatever they wanted. The people in the unlimited diet had significantly higher levels of testosterone than the men that were doing some sort of low carb diet or low fat diet, or a diet that consisted of fat, but not much saturated fat. So remember that saturated fat is coming from animal products. When people pretty much eliminated meat from their diet, that increased that significance, that ratio of polyunsaturated fatty acids and some monounsaturated fatty acids, which drove their testosterone levels down. Now, there is a point where, some people think of that dose dependent, where you go, well, if 40% of my calories from fat is better than 20% of my calories from fat, then 60% of my calories from fat is even better than 40. I get that logic. However, there does seem to be some evidence that if those levels become really high and you're not getting an adequate amount of carbohydrates, so if that high level of fat is crowding out the carbohydrates in your diet, so maybe that level is so high because 70% of your calories come from fat and then nearly 30% is coming from protein and almost no carbohydrates, that did seem to have a negative impact on testosterone levels as well. So it would seem that somewhere around 40% is the sweet spot. You could probably push a little higher if you're also getting healthy carbohydrates in your diet, maybe some fruit and vegetables, and those seem to be able to improve your levels even higher than, eating no carbohydrates at all. Now, there's another study that came out of Spain that ended up being about 209 guys. They were college age, so between 18 and 23. These guys are not typically going to be people that you would assume are going to struggle with hypogonadism or low testosterone levels, which is usually what these studies are done on, is older guys that are starting to have issues. And so we don't have for a while, didn't have great evidence on how this stuff applies in young men. Well, they took this, and what the focus of the study was really reproductive health. And so they were testing things like not only just hormone levels, not testosterone levels. They did test that, but they were also testing testicular volume. So how large a guy's testicles were and how that changed based on their dietary fat intake. And then also the quality of their sperm. So meaning their sperm count and their sperm motility. So what they found is monounsaturated fatty acids was inversely associated with free testosterone levels and total test. Now, monounsaturated fatty acids, it doesn't mean they're bad. So like what I told you up here, fatty fish, olive oil, avocado, walnuts, pumpkin seeds, those things all have really good benefits. So you shouldn't exclude them from your diet, but we just want to think of, what is the ratio we're eating those things? There's a positive association between polyunsaturated fat, particularly omega-6 and luteinizing hormone, which is likely going to help you produce testosterone from Leydig cells in the testicles. And let's see, omega-3 fatty acids were positively related to testicular volume. So it actually increased the size of the testicles, not like to a dangerous level, but showing that they were more active. Omega-6 and trans fats were inversely related to testicular volume. So, trans fats, I told you, we should be avoiding those at all costs anyway, but those are going to decrease testicular volume. They're also associated with lower levels of total test and free testosterone. And like we said before, really a lot of that trans fat is going to be derived from polyunsaturated fat, which we already know at this point is increasing sex hormone binding globulin, which is reducing that free testosterone for your body to use. Now, interestingly, that became really dramatic in the guys that were eating the highest levels of trans fats, which it's not just seed oils. You're going to start getting trans fats in things like fried food. Sorry, I know it's really disappointing to a lot of people, but a lot of food is fried in hydrogenated oils like margarine and Crisco, especially if you're going and eating them at a restaurant. Margarine, which is a hydrogenated oil, is very inexpensive, and Crisco is very inexpensive, and it is commonly used to fry food. And so if you're eating a lot of fried food, you're going to be eating a lot of polyunsaturated and trans fats, which are going to increase those sex hormone binding globulins, which is going to reduce that accessible testosterone. And in this study, they showed that the highest quartile, meaning the top 25% of guys in the trans fat category, the ones that had the most trans fats in their diet, they had 37% lower sperm count. So if you are working on having a baby or you're worried about your fertility, eliminate trans fat. 37% reduced sperm count. That's super significant. 15% lower testosterone levels. So that's huge. 15%. That's the same number we got earlier from reducing your fat calories from 40% down to 20%. So just eating, a high level of trans fat will decrease those levels at an additional 15%. And those guys also had a 4% lower testicular volume. So just in general, eating trans fats at particularly high levels is going to be working against you really significantly if any of your goals and health goals pertain to anything masculinizing. Keep in mind that testosterone levels are also going to be cardioprotective, meaning they're helping your heart, they're keeping your bones healthy. So those trans fats are really, really working against you. Not to mention the kind of damage that they're doing to your arteries, your blood vessels, your cell walls. So just stay away from them. If you see margarine, Crisco, hydrogenated oils, find something else. Really, if you're eating that stuff, you're probably eating a super inexpensive processed food. Pay a little bit more and get the natural version or organic version or whatever. If there's not a natural organic version of whatever that food is, steer clear. But you can find this stuff in like peanut butter sometime. That's, one example you might find it. Get the natural version or just go somewhere and get some ground up peanuts as peanut butter. There's plenty of places you can find, stay away from those. So what it kind of looks like, ideally, is you'd be eating somewhere around 40% of your calories from fat, and a really significant level of that is going to be saturated fatty acids and monounsaturated fatty acids. So, eat meat, eat butter, full fat dairy is a saturated fatty acid, and add in that weekly or bi-weekly piece of salmon, avocado, even though some of those showed that it was inversely associated with serum levels of free testosterone, it doesn't mean that you shouldn't be eating any of it. It's just that if monounsaturated fatty acid is like your only source of fat, then it is going to negatively impact your testosterone levels, which is why vegans and vegetarians very typically are going to have low testosterone levels, because they're not getting much saturated fat. And they're getting a double whammy, because not only are they not getting that saturated fat, which is increasing testosterone levels like fat, dairy, butter, eggs, they're not getting any of that. And unless you have like a lacto-ovo vegetarian, which is a vegetarian that eats eggs and milk, if they're not getting any animal, any animal proteins, any animal fats, they're only getting those monounsaturated fatty acids and polyunsaturated fatty acids. So they don't get that boost of the saturated fat. And additionally, they are getting an increase in the sex hormone binding globulin from those polyunsaturated fatty acids. So a little bit of testosterone they do have circulating, it's getting bound up by the SHBG, which is pushing their accessible test levels even lower. On top of that, a lot of vegans and vegetarians are eating soy products to replace meat, which are phytoestrogens that can additionally negatively impact your testosterone levels. So if you are a vegan or vegetarian that is struggling with libido, virility, focus, weight loss, muscle gain, bone health, cardiovascular health, all of these things that we think of as, typically male characteristics, if you're struggling with those things, this very well could be the reason, is that your levels of fat, those ratios are really skewed of that saturated fat and monounsaturated fat and polyunsaturated fat. So it might be something worth addressing. Also, it is the case that low-fat diets can lead to weight loss as long as you're not replacing that fat with something bad, meaning we're not replacing it with sugar. And that's really going to be one of the biggest ones, that people are going to replace fat with sugars or margarine, something like that, which is not beneficial at all. Those can lead to a lot of weight gain. A lot of people that do really low-fat diets end up eating a ton of carbohydrates, which is going to lead to, if you'll watch my past video about insulin resistance, low fat is typically going to push you towards insulin resistance, because you're going to have to replace it with carbohydrates. That's really going to push up your blood glucose and then push up the insulin. If you are trying to, like I mentioned in that previous video, if you're trying to improve your insulin resistance, a diet as high as 70% of your calories from fat may be appropriate. So, the dietary fat isn't all about what it's doing for your testosterone. There's other things at play here, but that's just what this particular video is about. So keep that in mind, and know that if you go on a really low-fat diet to try to lose weight, there's a strong possibility that what you're going to do is temporarily suppress your testosterone levels. So that is not, if you do that short term, typically guys that are going to do that are only going to be doing that for maybe a bodybuilding prep, where they're going to eat tiny amounts of fat and carbohydrates. Mainly all they're eating is protein, and that is usually going to be at the end of like a peak, like you're just getting ready for a show. And guys that do that can tell you they feel like crap. I've done really low fat diets for short stints to get, get somewhere, for me, low 7% body fat, somewhere around there. That's what it took to do that for a little bit. You don't feel good. You don't feel virile. You don't, you might look really lean, but it's not something that's sustainable, and it shouldn't be something you should sustain long for a bunch of reasons. But one of them here should be for healthy hormone balance. So if there's anything here that I brought up that maybe I didn't explain enough that you have questions about, let me know. You can comment or contact me any way you see fit. You can go to BrooksBrownCoaching.com and get in touch with me there. If you think maybe you're having, maybe your diet's not exactly where it should be, and you'd like to maybe make some changes that could improve testosterone levels, you can get in touch with me there, and we can work out a plan for you. Maybe you're already doing something, but you just want to know, is it the right thing? Or are there any little tweaks? You've already got a plan, you just want a little bit of advice on it. You can schedule a call with me on BrooksBrownCoaching.com, and we can review your plan. Or generally, if you just have some questions about diet, exercise, health, whatever, there's a way you can do it there. If you've made it this long, I appreciate it. If you will, please like, comment, subscribe. Let me know anything that maybe you would want to learn more about in the future that I could help with. And thanks for watching. Hope to see you again next time.